Hello everyone. Today we are going to discuss bipolar and related disorders. We are going to learn how to diagnose them, how to define which symptoms can be diagnosed as bipolar 1 and which can be diagnosed as bipolar 2. We learn the treatments, we learn the etiological causes and everything. First is bipolar disorder. What is bipolar disorder? Bipolar disorder. Bipolar means two poles. So it's like two major extreme moods. So one pole, let's say mania, where the person is high, happy, elated, and the second pole is the lowest a person can be, which is depression. So it defines two extreme moods of a person. For a diagnosis of bipolar 1 disorder, it is necessary to meet the criteria for a manic episode. We always need one manic episode in order to diagnose a person that person has bipolar 1 disorder. The manic episode may have been preceded by and may be followed by hypomanic or major depressive episodes. The manic, what does this statement means? It means that the manic episode can come before hypomanic episode and a major depressive episode, or it can also come after a hypomanic or a major depressive episode. But there is a necessary requirement that in order for us to diagnose a bipolar 1 disorder, there has to be a manic episode. What is a manic episode? A manic episode is not a disorder, but it is a type of bipolar disorder. We will discuss that later. But first, we are going to understand what is a manic episode. A manic episode is a period of time where a client experiences elevated, expensive, and notably irritable mood, and it should last for 1 week. 1 week. They are usually very irritable. They have grandiosity or high self-esteem. They feel that they are on the top of the world and they can achieve anything, or they feel that they don't need to rest. They are okay. They are going to achieve a lot of goals. They are usually very irritable. They speak fast, like very fast. Okay, so this is a manic episode. What are the symptoms required for us to diagnose manic episode? We are going to discuss the next. Manic episode. So what is manic episode? As I mentioned earlier, it's an expensive and irritable mood, elevated mood that should last for minimum 1 week for us to diagnose it. Or it can be more than it if hospitalization is necessary, right? So during the period of mood disturbance, three or more following symptoms have persisted and have been present to a significant degree. In order for us to diagnose a manic episode, we need three symptoms and four if the mood is only irritable. What are the symptoms? Inflated self-esteem or grandiosity. The person feels that he's the best, he can achieve anything, he's always right, he's never wrong. Then the person has a decreased need for sleep. It means that they don't want to sleep, and the body also doesn't need the sleep. So they are that high. They feel rested after 3 hours of sleep. They are very talkative than usual. So let's say for example, the person is normal when he's not having a manic episode. He speaks in a normal tone, he speaks in a normal speed. But during the manic episode, they usually have this pressure to constantly keep talking, or they are very talkative than usual. Then what is the other symptom? The fourth symptom is flight of ideas or subjective experience, that thoughts are racing. Okay, they have so many ideas, they want to achieve everything, and they're constantly feeling something. Their thoughts are constantly, new thoughts are coming. One time, for example, one time they are thinking, I'm going to start a YouTube channel. The other time they are thinking, I'm going to take part in the cycling competition or run a marathon or write a book. So they have constant ideas going on. They have distractibility, which means that they cannot focus on one thing. They have increased goal directed activity. They want to constantly engage in activities that is goal directed, achieving good grades, writing a book, writing a poem, or participating in a marathon, like that, right? Then excessive involvement in pleasurable activities. So now keep in mind, pleasurable activities involve engaging in sexual behaviors, or spending $1,000 in at once to shop something, and if something like that that makes them happy, or that rewards them, right? So out of these seven symptoms, three symptoms are necessary for us to diagnose manic episode, or if the mood is only irritable, then four symptoms from B. Then the mood disturbance is sufficiently severe to cause marked impairment in occupational functioning or in usual social activities or relationship with others to necessitate hospitalization to prevent harm to self or others, or there are psychotic features. Criteria C, what does it mean? It means that the mood disturbance is so severe that they cannot function properly. Their body can experience a burnout, or they cannot study or go to school, or have developmental activities. When they are experiencing a manic episode, the relationship with others is complicated. Why? Because they are constantly speaking, or they are so high in the energy, or they are speaking so fast that the opposite person is like, whoa, calm down, I can't understand you, right? So what does this do? They cannot work properly. Why? Because they have distractibility, or they are so fast in speaking that the other person, maybe their colleague, is not understanding them, right? So the symptoms need to be severe, that causes impairment in their daily life functioning, or maybe there is a need to hospitalize them because they are very active and agitated, or they can harm themselves, like something. Because in a manic episode, or someone who is usually bipolar, they don't like people who they feel are getting in their way of achieving their goal, right? So they can harm themselves, or they can harm others. And that's why there is an important need to maybe hospitalize them in order to calm them. Criteria D is the symptoms are not due to direct physiological effects of a substance or a medical condition, right? So what does these mean? That if there is a man, if someone is manic, experiencing a manic episode, it doesn't mean it should not be because they have taken a drug, or they have a medical condition, and that's why because of that medicine they are experiencing this. It should be only because of having a manic episode, and it should not be a stress specifier, or a side cause, or an effect of a medicine or a substance like a drug, right? Note, what does the note says? Criteria A to D constitute a manic episode. At least one lifetime manic episode is required for the diagnosis of bipolar I disorder. As I mentioned earlier, in order for us to diagnose a bipolar I disorder, there is a need to at least experience one manic episode. If an individual has experienced only one manic episode in their entire lifetime, and that too in childhood, still we are going to diagnose them as bipolar 1, because we need at least one manic episode in order to diagnose a bipolar I disorder. What is a hypomanic episode? A hypomanic episode is a distinct period of abnormally and persistently elevated, expensive, or irritable mood. So, all the symptoms of hypomanic episode are same as manic episode, but there is one difference. And what is that? In a manic episode, the symptoms need to last a week, 7 days, whereas in a hypomanic episode, the symptoms can last, need to last at least 4 consecutive days, right? So in a manic episode, we need symptoms to last for 7 days, but in a hypomanic episode, we need symptoms to last for 4 days. During the period of mood disturbance, three or more of the following symptoms have persisted. We discussed all the symptoms, it's all the same, but if an individual has a hypomanic episode symptoms for 4 days, and then from the fifth they don't have the symptoms, then we are going to diagnose it as a hypomanic episode. And if the person has symptoms for 7 days and more than that, then we are going to diagnose it as a manic episode. right? So every symptom is the same. See, this is a kind of a slide that helps us understand what can be the types. If a person has mania and hypomania, then we are going to define it as bipolar 1 because there is a manic episode. If a person has only mania, then also we are going to define it as a bipolar 1 episode because mania is there. If a person has mania and depression, then we are going to again diagnose it as bipolar 1. If a person has only depression, then we can diagnose it depending on the symptoms, either a major depressive episode or persistent depressive episode. If a person has hypomania and depression, then we are going to diagnose it as bipolar 2 disorder. Why? Because in bipolar 2 disorder, we need at least one hypomanic episode and depressive episode, right? Bipolar 1 has only one additional specifier, it is rapid cycling. What is rapid cycling? People who experience or who live with bipolar episode experience the highs that comes with mania or hypomania. They also experience the lows that come with depression. When rapid cycling occurs, it means that four or more manic, hypomanic, or depressive episodes have taken place within a 12-month period, right? So, what is different in rapid cycling is that a person with rapid cycling may experience an intense manic episode 1 week followed by a severe depressive episode shortly after. So it's like constantly 1 week they'll experience highly manic episode and then after the next week they'll experience a depressive episode. So it is important for us to know that rapid cycling is not a diagnostic criteria for bipolar disorder, but rather a descriptive term used to characterize the emotional instability often experienced by those with it, right? For a diagnosis of bipolar II disorder, it is necessary to meet the criteria for a hypomanic episode and a criteria for a major depressive episode. We first used to consider this as bipolar 1, but we do not consider it anymore. Why? Because a hypomanic episode lasts 4 days, while for a manic episode we need minimum 7 days. So it's different. It, its epidemiological data is different, right? The next disorder is cyclothymic disorder. What is cyclothymic disorder? For at least 2 years, there have been numerous periods with hypomanic symptoms that do not meet a criteria for a hypomanic episode, and numerous episodes or periods with depressive symptoms that do not meet a criteria for a major depressive disorder. What is a cyclothymic disorder? It occurs when a person has hypomanic symptoms. They don't feel the need to sleep for more than 3 hours, or they have grandiosity and they are irritable and agitated, and they also feel depressive symptoms, right? Loss of pleasure, anhedonia, and everything. But they don't meet the full criteria for it for us to diagnose it. For example, let's say a person has hypomanic symptoms for 3 days. We need 4 days, right? So we cannot diagnose it, right? So this is when a person experiences all these symptoms, but they don't meet the criteria, full criteria for us to diagnose it as a hypomanic episode or a depressive episode. We need this at least for 2 years in adults and 1 year in children and adolescents, right? Hypomanic and depressive symptoms must be present at least half the time, and the individual should not have a period of remission for more than 2 months. Criteria for a major depressive, manic, or hypomanic episodes have never been met. The symptoms in criteria A are not better explained by another mental disorder. What does D means? D means that the criteria A symptoms are not because of any other mental disorder, right? So they don't have any other mental disorder. They only have these symptoms, and that's only when we can diagnose them as cyclothymic disorder. Okay, this criteria E says that we know the symptoms of hypomanic or major depressive or a manic episodes should not be because of a drug use or of substance use or any physiological effects or any medical disorders or any medications, right? And also The A symptoms of cyclothymic disorder should cause clinically significant distress or impairment in the person's daily life. Okay. Other bipolar conditions. We have other specified bipolar disorders where first is short duration hypomanic episodes and major depressive episodes. We know that for a hypomanic episode, we need 4 days of symptoms, right? But what, let's say a person has 3 days and a very short major depressive episode. So we are going to define it as short duration of hypomanic episodes and major depressive. Hypomanic episodes with insufficient symptoms and major depressive episodes. So let's say a person has insufficient symptoms for a hypomanic episode but sufficient symptoms for major depressive episodes. So we are going to give them this condition. Hypomanic episode without prior major depressive episode. Right? So they don't have a major depressive episode but only hypomanic episode or short duration cyclothymia. We need at least 2 years of cyclothymic symptoms, but let's say it's more less than 2 years. So we'll say short duration cyclothymia or unspecified bipolar disorder, where we can't specify or we cannot diagnose, the symptoms don't meet the diagnostic criteria, but there are symptoms that are affecting their daily life. So we are going to diagnose it as an unspecified bipolar disorder. We discussed what etiology means, proposed causes, and risk factors. Right? So, one of them is genetic causes. First degree relatives of like parents, children, or siblings of bipolar disorder have 5 to 10 times higher rates of both bipolar disorder and depressive disorders than relatives of the people without the disorder. For the people who don't have a bipolar disorder, and for the people whose relatives have bipolar disorder, are at different levels of risk, right? Bipolar disorder is associated with abnormalities in the functioning of amygdala or the structure of amygdala, which is involved in processing emotions, and prefrontal cortex, which is involved in cognitive control of emotion, planning, and judgment. High levels of dopamine are thought to be associated with high reward seeking behaviors, while low levels of dopamine are associated with insensitivity to reward. Thus, dysregulation in dopamine system may lead to excessive reward seeking episodes during a manic episode or a manic phase and a lack of reward seeking in the depressed phase, right? So these are some causes that can lead to a bipolar disorder. Several classes of drugs are commonly used in treating depressive disorders and the depressive symptoms of bipolar disorder. These drugs include selective serotonin or norepinephrine reuptake inhibitors, tricyclic antidepressants, and monoamine oxidase inhibitors. Tricyclic antidepressants were some of the first drugs used consistently to relieve depression. However, we don't use them much because they have a lot of side effects, right? The other is MAO, monoamine oxidase. Monoamine oxidase is an enzyme that breaks down the monoamine neurotransmitters in the synapse. What is a synapse? Synapse is a gap between two neurons, and when a neurotransmitter is released, when an MAO is released, when a neurotransmitter is released, MAO is an enzyme that breaks down the neurotransmitters. Okay, so monoamine oxidase inhibitors, MAOIs, prevent the breakdown or decrease the breakdown of MAOs and thereby increase the levels of these neurotransmitters in the synapse. The MAOIs are as effective as tricyclic antidepressants, but their side effects are potentially quite dangerous. When people taking MAOIs ingest aged cheese or red wine or beer, they can experience fatal rise in their blood pressure. The MAOIs also can interact with several drugs, including antihypertension, medications, over the counter drugs such as antihistamines. The MAOIs also can cause liver damage, weight gain, severe lowering of blood pressure, and several same symptoms or side effects caused by the tricyclic antidepressants, right? Lithium. Another drug is lithium, may work by improving the functioning of the intracellular processes, right? So the intracellular processes that are normal in other people can be abnormal in people with mood disorders, and lithium works to improve these processes. Most people with bipolar disorder take lithium even when they have no symptoms of mania or depression in order to prevent a relapse so that they don't fall back to the old patterns again. People maintained on adequate doses of lithium have significantly fewer relapses of mania than people with bipolar disorders, right? Although lithium has literally been a lifesaver for many people with mood disorders, it possesses some problems. Okay. The main problem is that the difference between an effective dose of a lithium and a toxic dose of lithium is small, leaving a narrow window of therapeutic effectiveness. People who take lithium must be monitored carefully by a physician who can determine whether the dosage of lithium is adequate to relieve their symptoms but not so large as to induce toxic side effects. The side effects of lithium range from annoying to life-threatening. Many patients experience abdominal pain, nausea, vomiting, diarrhea, tremors, and twitches. Some people on lithium complain on blurred vision and problems in concentration and attention that interfere with their ability to work. Lithium can cause diabetes, hypothyroidism, and kidney dysfunction and can contribute to birth defects if taken during the first trimester of pregnancy. In the mid 1990s, it was discovered that a medication that helps reduce seizures, valproate, also helps stabilize mood in people with bipolar disorder. There are other anti-epileptic medications like carbamazepine, which can also be called Tegretol, Equetro, and lamotrigine, right? Have been approved for use in tests treating bipolar disorder. The side effects of these drugs include blurred vision, fatigue, vertigo, dizziness, rash, nausea, drowsiness, and liver disease. Valproate seems to induce fewer side effects and is used more often than carbamazepine. Lamotrigine is used especially for maintenance treatment and preventing episode recurrence, but the anti-epileptics can cause birth defects if women take them while pregnant, and they do not prevent suicide as effectively as lithium does, right? The anti-epileptics may work by restoring the balance between the neurotransmitter and amygdala, right? There is another treatment which is ECT, electroconvulsive therapy. Electroconvulsive therapy consists of a series of treatments in which a brain seizure is induced by passing electric current through the patient's head. ECT can lead to memory loss, difficulty learning new information in the following days after the treatment. So, if a person is given a electroconvulsive therapy, they have or they might have problems in learning new things or can have memory loss after getting the electroconvulsive therapy. What are some CBT based treatments or psychological treatments? One of them is behavior therapy. The first one we are going to do before CBT is behavior therapy that focuses on increasing positive reinforcers and decreasing aversive or bad experiences in an individual's life by helping the depressed person change his or her patterns of thinking or interaction with the environment or with other people. Now, what is CBT? CBT based treatment is a therapy that has two general goals. First, it aims to change the negative, hopeless patterns of thinking described by the cognitive models of depression. Second, it aims to help people with depression solve concrete problems in their lives and develop skills for being more effective in their world. So they no longer have the deficits and reinforcers described by behavioral theories of depression. Okay, so CBT like behavioral therapy or cognitive behavioral therapy is designed to be brief and time limited. The therapist and client usually will agree on setting goals they wish to accomplish in 6 to 12 weeks. These goals focus on specific problems that the clients believe are connected with their depression, such as problems in their marriage or dissatisfaction in their marriage or dissatisfaction with job. From beginning the therapy, the therapist urges clients to set their own goals and make their own decisions. Last cultural treatment is interpersonal and social rhythms therapy. ISRT is an enhancement of interpersonal therapy designed specifically for people with bipolar disorder. When people with bipolar disorder experience disruptions in either their daily routines or their social environment, they sometimes experience an upsurge in symptoms. By having patients self monitor their patterns over time, therapists help patients understand how changes in sleep patterns, circadian rhythms, and eating habits can provoke symptoms. Then, therapists and patients work together to develop a plan to stabilize the patient's routines and activities, right? Similarly, patients learn how stressors in their family, work, relationships affect their mood, and they develop better strategies to cope with these stressors. Studies show that patients who receive ISRT in conjunction with medication so, show fewer symptoms and relapse over time than patients who do not receive ISRT. Okay, if you have any doubts, please write it in the comments. Thank you for watching.